Hey Carmen, the symptoms you're experiencing are all related. Your blood test shows a decrease in levels of red blood cells, hemoglobin, hematocrit, and NCV. You're having a type of iron deficiency anemia. Why does anemia appear in pregnancy? During pregnancy, especially in the second and third trimesters, the need of iron in pregnant women increases to compensate for the use of the fetus. If the diet does not provide an adequate amount of body's reserves of this mineral were already low initially, the future mother runs the risk of anemia due to a lack of iron. In addition to weakening the body, anemia can interfere with oxygenation of the fetus. It is essential to prevent it, and if it occurs, treat it intensively before the situation gets worse. Daily iron requirements. Iron requirements during the first trimester are relatively small, 0.8 milligrams per day, but they rise considerably during the second and third trimester, up to 6.3 milligrams per day. Therefore, the appearance of anemia during pregnancy is relatively common. There are many reasons why pregnant women may have iron deficiency. 1. The hemodilution process added to the increased need for iron and low diet. 2. Pregnancies with twins increases the probability that the woman suffers from anemia because not 1, but 2 or maybe 3 children turn to her iron reserves. 3. The presence of uterine fibroids that cause small frequent bleeds. 4. A placenta previa responsible also for the bleeding. It is suitable for all pregnant women to undergo blood tests as soon as they discover they're expecting a child. The values of hematocrit, serum iron, ferritin, and transferrin are checked to check the body's availability. The risks for the mother and the fetus. Carmen must not underestimate the symptoms you are presenting because iron deficiency is a known disorder for many pregnant women. If it is neglected and becomes severe, it can have severe consequences for the baby. Therefore, the shortage of the mineral and hemoglobin can cause difficulties in oxygenation of the fetus and negatively impact on its well-being and development. Furthermore, during childbirth, the mother will inevitably suffer blood loss. In the best case, about 200 to 300 cc of blood. If you reach the end of pregnancy with iron deficiency, you will necessarily have to resort to blood transfusions. Diet and supplements. Under normal conditions, a varied, balanced diet is enough to ensure the future mother the iron she needs. Many foods, both of animal, vegetable origin, and rich in iron, meat, especially red meat, eggs, fish, especially tuna, sardines, and cod, cereals, legumes, green leafy vegetables. In beef, eggs, and fish, iron is present in a chemical form that is easier to the body to process, and about 25% of what has been taken is absorbed. Suppose the woman is not at risk of anemia and has adequate iron storage. In that case, the Ministry of Health only recommends low-dose oral iron supplements during the second half of pregnancy. They will be taken in the form of provitamins rich of folic acid and vitamin B12. In contrast, women who have a deficiency of minerals should increase the intake as soon as possible. During pregnancy, the recommended daily dose is 150 milligrams of ferrous sulfate or 300 milligrams of ferrous gluconate. These doses may vary depending on each case, these amounts being those indicated or consumption without harmless effects of the fetus. Some supplements also contain vitamin C to facilitate iron absorption. Folic is beneficial. Another micronutrient involved in the process of hematopoiesis, that is, the production of blood, is folic acid or vitamin B9. All women who try it, a pregnant woman, are advised to take a daily dose of 0.4 milligram of folic acid at least once a month before the pregnancy until the first waiting trimester, since the deficiency of vitamin during the first week of pregnancy dramatically increases the risk of developing severe neural tube defects such as spina bifida. Folic acid deficiency produces a type of anemia called megaloblastic. Once your anemia is corrected, the symptoms you're presenting will also disappear, so do not worry and try to follow your doctor's instructions. Continue with follow-up appointments until you bring your pregnancy to a satisfactory end.